All right, let's try to conclude the part 2 of the examination of the cranial nerve. So remember, wiper plus IPPA, but not all of the IPPA would apply. Now, cranial nerve 7, that's the facial nerve. From the name, supplies the muscles of facial expression and buccinator. So the first thing you want to do is you want to ask the patient to look up. You want to check for wrinkling. You want to ask the patient, close your eyes. You want to try and open. Yeah, once you've done that, you want to ask them to smile. You have to check for whether there is problems with the smile. You want to ask them to blow their cheeks. Incontinence. So usually this is this test for the facial nerve. Now, after you've done that, the next thing you want to test for is the vestibulocochlear nerve, which has hearing and balance, isn't it? So two popular tests is the Weber's test, where you strike the tuning fork, you put here, and you ask the patient where they hear it the most. So I would task the students to learn about the interpretation of the Weber's test. The next is the Rene's test, where you strike, you put it on the mastoid, and you ask the patient to tell you when they stop hearing it. Once they've stopped hearing it, you take it here and you ask them whether they can hear it. And then you do the same thing on the contralateral side and then ask them whether they can hear it. Great. So that does that for the vestibulocochlear nerve. Now the glossopharyngeal is tested by asking the patient to say ah, open your mouth and say ah. You want to look for retraction of the uvula, and then also for the gag reflex. So you want to use the spatula, open your mouth and touch the posterior. It creates gag reflex, which is mediated by actually the 9th and 10th cranial nerve. The vagus nerve is tested, that's 10, by asking the patient to cough. I test the vagus nerve, as well as also by articulation, which involves cranial nerve 7, 10, and 12. So you want to ask them to list the days of the week. So you want to say Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. And then next you want to test accessory, spinal accessory. So you want to ask them to shrug their shoulders against resistance, so you feel that. And you also want to ask them to push my hand and feel for the muscle here. And you do the same thing, you look for the sternocleidomastoid muscle. Finally, you want to assess the glossopharyngeal cranial nerve 12. You want to say, bring your tongue out. And then you want to say, do this. Push against my hand. Good. So that completes the cranial nerve examination. So let's quickly recap. So the facial nerve, you test the various branches of the facial nerve. I've explained the branches of the facial nerve in one of my previous videos, where I use something like this, the 5 branches. Then you want to assess the vestibulocochlear nerve using Weber's and Rene's test, then the vagus nerve, then also the glossopharyngeal, and the accessory and hypoglossal nerve. Thank you. Thanks for listening, and please continue to follow, subscribe, and share the channel.